So other strategies that I try to encourage patients thinking about and doing is really exercise. Exercise and nutrition and calcium, vitamin D alone is not going to be the only treatment for osteoporosis. It's a supplement to your treatment to keep your bone mineralization healthy and to prevent falls. So women who come in and men who say, oh, I'm not going on any medication, yet I had a fracture and I have osteoporosis, I'm just going to do diet, exercise, calcium, and vitamin D. I say that doesn't work, but that's a minimum. And diet, the exercise component is really to strengthen your extremities, to encourage balance. As you said earlier, Tai Chi is very good for balance. And what I tell people to do is to try to brush your teeth at night, standing on one leg. So you're by a counter. So if you get dizzy, you can fall over on the counter. But if you can stand on one leg and brush your teeth, work on that cerebellum, the area in the brain for balance, and also strengthening your legs so you can hold yourself up. So if you trip, you can catch yourself.
I could not agree with you more on that. People know that BMD goes down as we get older. Well, not surprisingly, lots of things go down as we get older. Muscle mass goes down, reflexes go down, and maintaining lower body strength, minimizing fall risk is critically important in lowering one's risk of fracture. And I mean, the whole reason why in the Mayo Clinic data, wrist fractures peak earlier, in the 50s, and hip fractures take off later in life. And as hip fractures take off, wrist fractures go down. They discovered it's because when the 50-year-old woman or 55-year-old woman trips, she has enough reflexes to fall forward and to be able to break her fall with her outstretched hand. She gets a wrist fracture. When the 80-year-old woman falls, she's more likely to fall sideways or backward, not block her fall with her hand, and she's essentially trading a wrist fracture for a hip fracture. So falling and how one falls are very critical components in what is going to happen to your bones as far as fracture. And anything that can be done to lower falling risk, which I tell patients to make sure you don't keep shoes on the floor and loose rugs on the floor and phone wires on the floor. And also, as important as osteoporosis is, and it's critically important, most men and women in this country will still die of cardiovascular disease. So you should do exercise for your general health. And a side benefit is a lot of the exercise will also be helping your osteoporosis risk by loading your skeleton and by loading your muscles and decreasing your fall risk.